I would like to use a clinical case as my workplace. A 96-year-old man has had regular dialysis sessions on Mondays, Wednesdays, Fridays over the last 3 years. He has medical background and state of kidney disease, no cognitive impairment, type 2 diabetics. Last Friday, the 3rd of October 2025, he arrived the hemodialysis center and stated that he wanted to stop dialysis because he has felt that he had been very tired of attending dialysis 3 sessions a week. The renal register saw him and discussed of all the adverse outcome of stopping hemodialysis. So this means that he will die from fluid overflow and uremia. He was fully aware of the consequence. And I'm going to use the model ILAC issues, law, argument, and conclusion to discuss the legal issue. So my legal issue here is that is the patient right to refuse medical treatment? In other words, does the patient have right to refuse the medical treatment? I will outline the legislations at common law and in all stage, and the argument and the conclusion and the strategy. I have found the facts that, according to Australian Law Reform Commission, at common law, all competent adults can consent to and refuse medical treatment. If consent is not established, there may be legal consequences for health professionals. Under the law of three parts, patients have a right not be subjected to an invasive procedure without consent or other lawful justification, such as an emergency or necessity. At the international level, the Conventions on the Rights of Persons with Disabilities, or the CRPD, expresses this in terms of a right to respect for his or her physical and mental integrity on an equal basis with others. I have found policies in all states in Australia. There are legislation in each state supporting this law, and it is evident that Department of Health of each state established its own policy regarding this matter, and I have provided the list of the policy in a reference. Within 5 minutes I can't show you the policy, but it is in the reference list. I have found approved precedent cases are Hunter in New England, an area, and VA in 2009, and another case is called Dame Elizabeth Slot P and I in 2002 in the United Kingdom. The argument here is that the patient has the right to refuse or to consent to a medical treatment when they are competent. Does mean that the patient doesn't have cognitive impairment. Our patient has been assessed by medical officers before. The patient has no cognitive impairment. Therefore, the patient has his own right to make his own decision. The patient is capable to make decision to refuse dialysis. Conclusion: at a common law, a person does have a right to refuse medical treatment. This right is set to stone from a competent adult's right of autonomy or self-determination, and thus is the right to control his or her own body. And the strategy here is that, as I mentioned above, we have to respect the patient as per health policy. And below is the reference list. You can click on it and can see the policy.